Welcome back. In this session, we are going to discuss about Sanicula, Sanicula Aqua, which is nothing but the mineral spring water. Sanicula Aqua is prepared from the spring water of Ottawa. So there's a short story behind it. It is proved as by the deleterious effects by Dr. J.G. Gundalch, who with his family drank it for more than a year and was still suffering from the effects 5 years later. So we see that Dr. J.G. Gundalch, he drank the mineral spring water for a period of 1 year and he was suffering with the bad effects of this for more than 5 years later. He later evaporated it, triturated and then potentized the salt and proved it, the drug proving the usual way. He proved it in the usual way under the auspices of American Dr. Sherbina. So we see that Sanicula later was proved to be a great remedy in our materia medica. So you see, it was proved by the physician J.G. Gundalch in 1890, and it is one of the deep-acting constitutional polycrest remedy. Sanicula is a polycrest remedy, and this remedies usually have to be prescribed in higher potencies. So we move further with the certain salts which are present in the Sanicula Aqua. So the mineral spring water contains these salts, that is natrium, calcarea sulf, calcarea carb, magnesium mure, alumina and silesia. So the objective of placing these salts here is for you to understand that these salts will also exhibit some of their properties in Sanicula. The Sanicula will show up certain characteristics of these salts because these content are present in the mineral spring water, which is nothing but the Sanicula Aqua, and this Sanicula Aqua, it gets the name from the spring named Sanicula, which was located in US. So this spring was located in US. It was located in US, and the Sanicula, and the spring named Sanicula. So it is the spring water is used to prepare, the mineral water of the spring is used to prepare the remedy. So it gets the name from the spring. The spring's name is Sanicula, which is located in the US. So we know certain background and history about the Sanicula Aqua, how it was accidentally proved by J.J. Gundalch, and what are the salts which it contains. Now let us move further with the sphere of action. So where does Sanicula act on our body? So the Sanicula has its action all over the body. What did I tell you in the first slide? It is a polycrest remedy. Since it is a polycrest remedy, the action can be seen all over the body, but especially it will act on the gastrointestinal tract. It will act on the female genital tract, the female sexual organs, skin, and the nervous system. Clear, guys? It acts on the GIT, female sexual organs, skin, and nervous system. So we see that is nutrition acting on the. So it plays a major role in nutrition, which we'll discuss in the upcoming slides. For now, remember what is the sphere of action? GIT. Nutrition, GIT, and we have female, skin, and nervous system. Yeah, let's move further. What are the ailments from? Ailments from are slight jarring or strains, cares, too much worry, tension, care are the ailments. Then, what is the physical makeup of Sanicula Aqua? It is a children's remedy in a materia medica. So, the child will look old, dirty, greasy and brownish. The child is old, dirty, greasy, brownish child. He looks old. The baby is looking old. He's looking old, and the skin has this greasy, browny appearance. And the skin about the neck is going to be wrinkled. It will be hanging in the folds. The skin around the neck will hang in the folds, and there will be dandruff on the scalp, eyebrows and beard. Okay. So thinking of the dandruff on the scalp, eyebrows and beard, which miasm can we think of when there is dandruff on the scalp, eyebrows and beard? That is, we have psychotic miasm. Okay, psoric and psychotic miasms in the background. So we see physically the baby will be extremely emaciated. The skin will be hanging, wrinkled in folds in the neck. Malnourished child. So nutrition, it is indicated in the malnourished child who's weak, dirty, greasy appearance of a child. Moving further, the Sanicula aqua, the main keynote symptoms, the guiding symptoms we are starting with, they keep changing their job. So the patient comes to your clinic, and when you take the history, he says he quits the job very often and keeps changing his jobs. So what is the main purpose in Sanicula for changing the job? That is, there is instability of the purpose. They keep changing. There's no aim, no intention. They have no aim in life. There is no particular intention, no goals. The purpose is unstable. There is instability in their purpose. Okay, they keep finding reasons, they just change the job. Instability in their purpose, no aim. They don't want to work for a certain period, get promotion, then it's not like they want promotion, want to earn more. That's the reason they are switching their jobs. No, they have no aim, no intention in Sanicula aqua. Moving further, what are the mental symptoms of Sanicula baby? The child cries, kicks, and desires to be carried. The child wants to be carried. The Sanicula aqua baby wants to be carried, doesn't like to be looked at. Okay, if you just look at the child starts, crying, kicking. So the child does not desire to be looked upon. Sanicula child cries, kicks, and he wants to be carried, but he wants to be carried by the mother or the father or the one who is taking care of them, but he does not like anybody looking on to him. The child is very obstinate, touchy child, always touchy, clingy, and we have irritable, angry, does not want to be touched. There is fear of downward motion. Okay, the baby does not want to be touched by anybody, does not want to be looked at. He is very irritable, angry, wants to be carried, very obstinate baby. Cross, quickly the baby is alternating with laughter and again playfulness. You can see that in children. So they'll be laughing, and again they'll be cross, irritable. Once they'll be cross and irritable, contradicting, they'll not obey what you say, very irritable, unpleasant. Later, after some time, it will be alternating with the playfulness, cheerfulness, laughter in the children. Moving further, what are the fears in the Sanicula? Can you guess the pictures? What could be the fears? You can put them in the comment section. The fear could be of the robbers. So we have this, the fear of robbers, fear of darkness, and they have the fear of downward motion. They also fear that some impending misfortune. They fear of some impending misfortune. They fear darkness. They are afraid of this impending misfortune. Then they are easily upset by the slightest words or acts. They get upset, and here they have a fear of the downward motion, fear of darkness. Their constant irresistible desire to look behind her as if she's been followed. They have this desire, so they are walking on the road, but they have this constant desire to keep looking back. They feel as if somebody is following them. The patient dreams of robbers. He searches the entire house. Okay. So we saw the fear. We studied about the mental symptoms of the baby. And then the patient has a desire to keep looking behind as if he is being following. Next are the discharges. The discharges in Sanicula are very offensive. like the rotten cheese or the fish brine. We know the miasm, psychotic. So the smell, the discharges are going to smell like that of a fish brine. Rotten cheese, offensive smell like a rotten cheese or a fish brine. Stool, flatus, leucorrhea, etc. The no amount of washing will get rid of it. So the discharges, they are so offensive. The stool, the flatus, the leucorrhea, they are so offensive with a rotten cheese and fish brine smell that in spite of washing it for multiple times, you will never be able to get rid of that smell. So the patient has this characteristic cheese, rotten cheese, okay, the rotten cheese and fish brine smell, which is present in all the discharges. The rotten cheese stools, the stools which are smelling like a rotten cheese, and the other remedies where the stools will smell like a rotten cheese are heparself, tuberculinum and bryonia. Moving further, the Sanicula, Medorinum and Thuja have offensive discharges. We will discuss about the discharges, okay, particular discharges in each of these remedies. Now if there are discharges which are offensive like the rotten cheese or fish brine, the other remedies are, first we see that if the otorrhea is nothing but the discharges from the ear. If the otorrhea is smelling like a fish brine, the remedies are tellurium, graphitis and naja. Let's just mark here. If the otorrhea smells like a fish brine, what are the remedies? We have tellurium, graphitis and naja. If the nasal discharge smells like that of a fish brine, then the remedies are elapse and thuja. Okay, elapse and thuja. If the stools are smelling like that of a fish brine, then we have medorinum. And the urine smells like fish brine or a rotten cheese, the remedies are Sanicula, Buforana and uranium nitricum. Okay, uranium nitricum, Bufo and Sanicula. And we have leucorrhea. If the leucorrhea is smelling like that of fish brine, then the remedies, can you guess them? Leucorrhea smelling like a fish brine. We have thuja, medorinum, and the other remedies are Sanicula. Okay, clear guys? Can you just revise it? Otorrhea, the other remedies which have a fish brine odor. What are those? Otorrhea, we have tellurium, graphitis and naja. In intestines, medorinum. In the urine, we had Sanicula, Bufo and uranium nitricum, and again leucorrhea, Sanicula, thuja, and we saw the medorinum. In the nose, the nasal discharge which is having a rotten cheese smell, we saw that elapse and thuja. Clear. Moving further, what are the desires? The desires in Sanicula. Sanicula desires hamburger. They desire hamburger and sweets, candies, the junk food and milk, egg, salty things. Okay, clear guys? So let us move further with we are done with the desires. Moving further, we have the sensation of a burning. Okay, they have a constant burning sensation, and this burning sensation is especially seen at the feet, and also the tongue feels as if burning. The soles of the feet are burning of soles and feet, the burning of the tongue. So the patient has to uncover the feet. You can see the patient is uncovering the feet. There is burning of the soles of the feet. The patient has to uncover, or he has to put them in a cool place like lachesis, medorinum, sanguinaria, and we also have sulfur where there is burning, and the patient has to put out the feet for the relief. Even in sanguinaria there is burning, medorinum, lachesis, they have this burning of the soles of the feet. They must uncover or put them in a cool place. So the other remedies we saw: sulfur, pulsatilla, medorinum, chamomilla, sanguinaria, macabre, macmure, and they have this burning. The patient has a burning in the tongue, so he protrudes the tongue out to get this cold air. He keeps the tongue out to keep it very cool, and the tongue will be large, it will be flappy, there is burning in the tongue, so the patient will protrude the tongue to keep it cool. Clear? Moving further, dandruff is seen on the hairy parts, like the profuse dandruff is seen on the scaly dandruff. It's seen on the scalp, eyebrows, on the beard, and then the dandruff on the chest. Okay, on all the hairy parts. You can think of the men who are having hair on the chest, beard, eyebrow, scalp. It's very scaly. The dandruff, you can see it is so scaly here, and it is profuse, and it is seen on the hairy parts. Moving further, the offensive acrid foot sweat is destroying the socks and the shoes. Like Silesia, the sweat is so offensive and sore. The foot sweat, which is seen between the toes, is going to be very offensive. It is sore, and on the soles they feel as if they had stepped in cold water, as if he had stepped in cold water. There's a sensation, and the sweat is so profuse that as if he has stepped in the cold water, it's going to be so profuse, and it is acrid foot sweat which is destroying the socks. The sweat which eats off the socks. So offensive and acrid it's going to be. The perspiration is seen on the occiput and also on the neck, which is aggravated when the patient is sleeping. He wets the pillow. You can see the perspiration. It is mainly seen on the occiput, and when the patient sleeps, the sweat aggravates and completely he wets the pillow. Digestion is very slow. The children will vomit off the milk in the form of a thick curd. You can see in the picture the baby vomiting the thick curd. The digestion is very slow. The baby vomits out the milk in the form of thick curds, and followed by the vomiting, the baby goes into sleep. Constipation. The patient has no desire until a large stool is accumulated. So until the stool gets largely accumulated in the intestines, the patient has no desire, passes on for 3-4 days without passing stools. The days keep on passing, he does not pass stools. They have constipation, no desire at all until the large accumulation is occurring. And then later he must remove the stools mechanically. The stools will proceed and again recede back. We have this other remedy like Silesia also, where the stools will proceed and then they are receded back. Here the stools also recede back, so the patient has to remove the stool mechanically. Diarrhea is changeable in character and the color. The diarrhea, like the scrambled eggs, frothy diarrhea, grass green like the scum of a frog's pond. Okay, so we see the diarrhea. We also have the other remedies like macabre, where the stool is going to be grass green, frothy like the scrambled egg and scum of a frog pond. Moving further, this emaciation. The baby has the emaciation. In malnutrition it is indicated. Sanicula is indicated in malnutrition, where the baby is having ravenous hunger. In the children, the infants, their progressive emaciation is seen, like in Silesia and Argentum nitricum, and the emaciation is extending downwards. Okay, if the emaciation is very rapid, we have the other remedies like iodum, ars, creosote, plumbum, thuja, tuberculinum, where the emaciation is very rapid. Okay, the rapid emaciation is seen in cases of iodum, arsenicum album, creosote, plumbum, thuja, and tuberculinum. If the emaciation is upwards, okay, if the emaciation is going upwards, we have abrotanum. So the first it will affect the limbs, they'll be skinny, and they'll be having mummified legs. So the first affection is downwards, it is moving upwards. Down first it gets affected, later it is starting to move upwards. So we have abrotanum, argentum nitricum, then we have pin sylvestris. Downward emaciation. If the emaciation is downwards, if the emaciation is occurring downwards, we have Lycopodium, Natremure, Calcarea carbon, Sarsaparilla. Now let us move on to the particulars. Some of the particulars which are left over. Mouth, the tongue is going to be large, flabby and burning. You can see the tongue is very large, it is flabby and burning. He must protrude the tongue to keep it cool. And there are ringworms on the tongue. The tongue will have the ringworms. Okay. Stomach symptoms. The stomach is disordered from the slight jar. There is nausea and vomiting which is seen from the carriage riding. They have thirst for the little quantity of water. Very often they will have the thirst for a little quantity of the water. The water is vomited as soon as it reaches the stomach. The patient vomits back. Okay, as soon as the water reaches the stomach, it is vomited back. Appetite is increased. The patient feels hungry before the meals. He feels hungry. Good appetite. It has been increased. He craves for the fat, bacon, and salt. Okay, clear? Stomach, disordered stomach, nausea, vomiting, thirst. The thirst is just for the little quantity of water. You can see very little quantity of water. Very often there is thirst. Good appetite. He is hungry before the meals, and he is craving fat, bacon, and salt. Rectal symptoms, we saw most of the symptoms. It is indicated in constipation, where there's until and unless there's a large accumulation of the stools, the patient has no desire. And then the stool, he has to strain a lot. It will be partly expelled, and again it will recede back. So mechanical removal is required, like in Silesia and Thuja. There is crumbling at the verge of anus. Like in magnesium mure, they have the crumbling which is present at the verge of anus. Okay, the crumbling is present at the verge of the anus. Large evacuation of small dry grey balls, and they must be removed mechanically. Okay, they are evacuating dry grey balls. Stool is very hard, impossible to evacuate. They are grayish white balls, like the burnt lime, and white with the odor of a hamburger cheese. Okay, what is the characteristic odor of the stools? Rotten cheese or hamburger cheese. And the character of the stool, they are grayish white balls, hard, impossible to evacuate, grayish white balls, and they look like a burnt lime. Diarrhea, which is changeable in character. Stool, how is it going to be? Frothy, grass green. It turns green when it is standing on the diapers. It turns green like Thuja. It looks like a scrambled egg and scum of a frog pond. We have seen this character also in the other remedies like Helb and Macap. After eating, the patient must hurry from the table. Soon after eating, the patient has diarrhea. He must hurry from the table. The odor will be still present, like the rotten cheese odor will be still present despite of the bathing. Like in sulfur, the odors, it will be still present in the body in spite of bathing. No amount of washing can make him get rid of this odor. There is incontinence of feces and urine. The sphincters sometimes are unreliable, so there is urging from flatus. Patient must cross the legs to prevent the feces escaping. Since there is incontinence of feces, so to pass the flatus, the patient doesn't know, he has no confidence of the sphincters. So he just cross the legs while passing the flatus to prevent this feces from escaping. Okay. The sphincters are completely unreliable. You cannot be confident enough, you cannot rely on them. So the patient has a fear to pass the flatus. He crosses his legs so that he can avoid the incontinence of the feces. Moving further to the skin symptoms. The skin of Sanicula patient, how is it? It is dirty, greasy, brownish, wrinkled. Skin about the neck, how is it going to be? It will be wrinkled, it will be hanging in folds. We saw the other remedies, abrotanum, iodum, natrimure, SARS. Due to the wrinkling, the child will look very old and the profuse dandruff is seen on the scalp, eyebrows, beard. There is soreness behind the ears. You can see we saw the dandruff on the hairy parts, right? And the other remedy where there is dandruff on the eyebrows, we have sulfur. And there is soreness behind the ears with the discharge of white grey viscid fluid. And the soreness with the white discharge of white grey viscid fluid behind the ears is seen in graphitis and sorinum. The excoriation of the skin is around the anus. The other remedy is sulfur. That is the perineal area. There is excoriation of the skin, and this excoriation will later extend into the genitals. The sweat is very characteristic. Head, neck of the children will sweat very profusely. When the baby is sleeping, it will wet the pillow. Okay, calcarea and silicea are the other remedies where the profuse sweat is wetting the pillow. Foot sweat is also going to be very offensive, acrid. There's soreness between the toes, and we see the sweat on the foot as if he had stepped in cold water. So profuse is the sweat. You feel when you look at the patient's feet, you feel as if he has stepped on a cold water. There's burning of soles of the feet. The patient has to uncover them. He needs to put them in a cool place like lachesis, medorinum, sanguinaria, sulfur. So the complaints are aggravated in warm room and by scratching. There is excoriation of skin. Okay, you can see. Okay, the excoriation of the skin about the anus and soreness discharges, all of these. So with this we come to an end of the skin and the particulars, the modalities and the guiding symptoms, ailments, mental symptoms, the physical makeup of Sanicula. So before winding up, let us just see what are the major modalities we saw. The slight walking jar will aggravate the complaints, and they have amelioration by rest and lying down. I also want you to remember we also saw the female sexual organs Sanicula acts. Acting on the female sexual organs, it will cause the prolapse of the uterus. The prolapse of the uterus, where there is a bearing down sensation and the patient feels that the contents would escape, just like how the patient feels the stools would escape or the urine would escape involuntarily, so he crosses his legs. Similarly, the prolapse of the uterus, he feels the contents of the pelvis would escape out, so he desires to support the parts by placing his hand against the vulva. So what does he do? What does she do? She places her hands against the vulva. The other remedy is where she will place the hand against the vulva to provide support so that the contents of the pelvis don't escape is the lilium, tegelinum and muriatic acid. The soreness of the uterus and vagina will feel large. So there is soreness of uterus. They'll support the vulva. Okay, let us just draw like this. Okay, they'll support the vulva. And next we see there is soreness. There is soreness of uterus. The patient has the soreness of the uterus. There is soreness. And the vagina feels enlarged. Okay. And these complaints are also aggravated by walking, jar, slightest step, misstep, amelioration by rest and lying down. When the patient is lying down and resting, he feels amelioration. Clear? Anything left? I guess we have covered everything in the remedy. If you have any doubts, put them down in the comment section. If you want to provide suggestions for improving the lectures, please put them down in the comment section. And if you want any specific remedy to be dealt, you can request down again in the comment section. And thank you for being there, for paying attention in the video. And if you like the video, hit the like button.